It's difficult to decide when to choose to transfuse blood for a child with sickle cell disease. Yesterday, we discussed how to differentiate between low-risk sickle cell disease and high-risk sickle cell disease. We also looked at how to differentiate which surgery is low, moderate, or high risk. Now let's put it all together. The first one is pretty straightforward. If the patient has low-risk disease and the surgery is low risk, a transfusion isn't needed. However, if the patient is low risk, but the surgery itself is a moderate risk, you may want to transfuse for a hemoglobin less than 9. This is especially true if the patient requires general anesthesia for over an hour. If the patient is a low-risk patient, however, the surgery is high risk, then you may want to transfuse to get a hemoglobin S of less than 30%. This can be achieved by a simple transfusion if the patient is undergoing elective surgery. However, if the patient is undergoing urgent surgery, an exchange transfusion may be indicated. Now let's look at patients who have high-risk disease. If they have a low-risk surgery, they may not require transfusion. However, if their surgery is a moderate risk, you may wish to transfuse for a hemoglobin less than 9, and if their surgery requires general anesthesia for more than an hour. If the patient has high-risk disease and it's a high-risk surgery, you'll want to transfuse for a hemoglobin S of less than 30%. Again, if it's an elective surgery, you can do a simple transfusion, but if it's an urgent surgery, then you can do an exchange transfusion. Tailoring your transfusion strategy to the patient's risk is crucial. Follow the Anesthesia Patient Safety Foundation for more tips.